Dr. Will here from Miami Spine. We're back here with Ian. We just got him adjusted. Like I was saying in the last video, he's having a ton of tension in his lower back, specifically the QL, the upper glutes, the piriformis. So we're going to use our go-to tool for breaking up scar tissue, inflammation, and tightness, which is going to be the Shockwave device. Okay? So we have our ultrasound gel on, and what I'm going to do is I'm going to run the Shockwave up and down his erectors and across his glutes as well. Ready, Ian?
Sure.
Feel any soreness in there?
A little bit, yeah. Oh yeah, right in there.
Right by that side. So the great thing about the Shockwave is it's also diagnostic. So as I'm working it through different areas, Ian can give me feedback about where he's feeling the most sensitivity. Feel it mostly through here?
Yeah, right in there.
Going over to the other side.
Oh yeah, same thing. Right in there.
So we're looking at kind of L5, S1, SI joint, very common areas to have a lot of compression and tightness. Alright guys, there you have it. There's a little sample of the Shockwave therapy. I'm going to go ahead and finish Ian off with the rest of the Shockwave. But I just wanted to show you guys a little bit about how it works. It's an amazing new technology that I started offering in my office this year. Again, it's diagnostic, so it can tell us exactly where your problem is, just as accurate as an MRI or an X-ray at finding a soft tissue lesion. So that way we can identify where the problem is and treat it. I've seen a lot of success with not only back pain, but knees, shoulders, elbows, plantar fasciitis. So any sort of musculoskeletal issue that you have, Shockwave might be the tool for you. Thanks for watching, guys. We'll see you next time.